Another fact you want to know is the valves around the heart. So there are four valves inside the heart, grouped into two different types. So you have the atrioventricular valve and then the semilunar valves. So this is called this way just because of the way they look. So the atrioventricular valves will have two of them. You'll have the mitral and then the tricuspid. Why is it called tricuspid? Why is it called mitral? And that's just the anatomical look. If you were to open the heart and then see how those valves look and connecting in between atriums, ventricles, they have the tricuspid has a three shaft looking valve, whereas the mitral just has a two looking shaft. And this is also why it's called bicuspid in some textbooks. Now, the semilunar valves are very important because those are the valves that will help nourish the blood to the lungs, which is why it's going to be called the pulmonary valve. And then the one to the rest of the body, which is called the aortic valve. So where are these located? So from the right atrium to right ventricle, from atrium to ventricular, you have the AV tricuspid. Okay, so atrioventricular, right? The valve connecting here is going to be called tricuspid. The second one, the mitral valve or the bicuspid valve, again, we said the shape, is between atrium, ventricle, right here, the mitral valve. This is where it's going to be located. Now, we talked about two other types of valves, the semilunar valves. So the pulmonary one, again, where is it located? Think about it. It's in the pulmonary trunk, at the opening of the pulmonary trunk for it to divide inside pulmonary veins. So this is where the pulmonary valve is located. And then the last one, you can guess it, it's the aortic valve right here, and that's going from the left ventricle inside the aorta. The way the heart beats is contracting both atriums in the same time, pushing blood towards the ventricles. So when there's a filling of the heart atriums and then the SA nodes activate, you will have the heart contract, pushing those valves open, both mitral and tricuspid at the same time. Whereas the semilunar valve must be closed because what you don't want to happen is blood to go from left atrium to left ventricle directly towards aorta and pulmonary trunk because those ventricles haven't contracted yet. So if they haven't contracted yet, then that just blood is just going to push in here, get backflow, and that's just going to create a mess. So what you want to have is right atrium, left atrium, both contract simultaneously. Both semilunar valves are closed, right? So imagine this closed, imagine this closed. They create such a tension that the mitral and tricuspid, aka the AV valves, push open that valve. The blood fills both ventricles in the same time. Then you have a period where the ventricles are filled enough to the point where it's sufficient to the body. And at that point, you're going to have the AV valve closed, right? So they were open before. Now they close, they go backwards, they shut. And why is that happening is because you don't want blood to backflow. So you don't want some poor oxygen blood to go towards the vein and cause some turbulent flow and then you have blood that's just splashing everywhere. No. What you want to have is those two valves close, and then as soon as the ventricles contract, and when they have enough pressure, when enough tension for that ventricle to contract and push blood out of the body, then you will have the semilunar valves open. And at that point, so imagine having a balloon and you fill it with blood, and imagine the volume not changing, but the tension inside contracting as much as possible. That blood will push out at a great pressure, a lesser pressure here to the pulmonary trunk, but a great pressure for the aortic valve, pushing blood towards the rest of the body. And you have to think, why is it creating such pressure? Why does the heart need to beat so powerfully? It's because you have tissues at very remote areas of the body. So remember, the aorta right here needs to supply blood that are on your toes or that are in your fingers, or the same amount has to go inside your groin region and your abdomen. So that's why you have to have a difference in size between ventricles and also different pressure systems. But yeah.